Muy buenos días, Marlene, and good morning. Buenos días, everybody. As Marlene stated, very happy to be here, back to 2023. So let's celebrate 2023 with some new ideas, new strategies, and better way to serve the community in North Carolina. So today, we are here with this new framework, which is not new because we've been working for the past 3 years with the NC Latino COVID Task Force. We're just making a little transitions and more effective in terms about how we're working with the community across the state of North Carolina. And I want to say thank you to all the members of the NC Latino COVID Task Force has been engaged with the work we've done for the past 3 years. In the end of the year, we have a great celebration on our last event that we host, and we highlight a lot of the things that happened through almost all 3 years of work with the NC Latino COVID Task Force, but also with the different partners, community partners that came on board and working with us across different sectors. It's so amazing how much individuals and organizations we have out in the communities addressing social issues of our communities. So we look forward for a very productive 2023 engagement, collaboration, intentional, in spaces where we can all come together for addressing social issues within our communities. And I think if we can be strategized to how we can address those needs, it will be a great benefit for not just only the community, but all the community-based organizations and others that have been participating in the NC Latino COVID Task Force. So I'm looking forward to working with you guys for this 2023 and have some great results and great outcomes. So Marlene, thank you so much for being the great facilitator of this convening, and let's move forward. Thank you.
Thank you, Vencio. So with that, I am going to share the agenda. So this morning, we're going to start off by doing some introductions, just so we can see, it's a new year, who all has joined us on this call, because I do see a couple of new names. Next, we'll do the introduction of this new community task force. So like Vencio mentioned, it's similar to our COVID-19, but we just thought we should switch the language of it. So we'll be sharing that information with you as well. And updates, because I know there might be a couple of updates that you guys would like to share with us. And then I have two questions to ask you guys at the end and share a little bit more about what we have going on for this new task force and what we have planned for 2023. So with that, I'll go to the next slide, and then I will start calling on names based on the list. So if you could just state your name, agency, and the region you're covering. So I'll start off with Francisco Guzman. Good morning, Francisco.
Hola, good morning, everybody. This is Francisco Guzman. Recently, I joined the team of the NCDHHS as a minority Irish coordinator here at the Division of Child and Family Wellbeing. I'm pretty new, and I'm touching base to every single entity around North Carolina, because my role is to cover all Carolina for all those minorities, I mean the Hispanic ones, or other nationalities as well. Thank you very much for inviting me.
Thank you for joining us this morning, Francisco. Next, I have Jorge Guzman. Good morning, Jorge. So I'll move on next to Leo. Good morning, Leo.
Good morning, everyone. Can you hear me?
Yes, we can.
Sorry, PC was not working well. Leo Scarpati with Blue Cross and Blue Shield of North Carolina. I cover the entire state in terms of our diversity, equity, and inclusion work that we're doing in multicultural communities across the state.
Thank you for joining us this morning. So next I have Sergio. Good morning, Sergio.
Good morning. I work at the Department of Agriculture with the pesticide section. We are dealing with the Latino community, mostly related to farm workers community and all areas related to food drug administration and a few more areas which are included in this community.
Thank you for joining us this morning, Sergio. Next, I have Alma. Good morning, Alma.
Good morning, everyone. I hope you are doing just great over there. I hope this is a very nice year for everyone. And I am from the Universidad Veracruzana in Poza Rica, Veracruz. I work with families. I am especially interested in indigenous families, Totonacans, which is the indigenous group that lives over here where I live.
For joining us this morning, Alma. Next, I have Amy Corey. Good morning, Amy.
Good morning. I'm Amy Corey. I'm with Healthy Blue. We're one of the Medicaid healthcare plans.
Thank you for joining us this morning, Amy. Next, I have Anne Marie.
Hi, my name's Anne-Marie. I work with the North Carolina DHHS, DDMH, SUS services as a community outreach engagement specialist.
Thank you for joining us this morning. Next, I have Camden Stewart.
Hey, my name is Camden. I am at the Henderson County Department of Public Health out in Western North Carolina.
Thank you for joining us this morning. Next, I have Carlotta Dixon.
Hi, Marlene, this is Jasmine. I see that Carlota put on the chat that her mic is not working. She doesn't have a mic. She is also with the North Carolina Department of Health and Human Services, DSS, and she's also covering all 100 counties.
Thank you, Yasmin. So next I have Comunidades 4. Good morning. No mic, no worries. You can just enter your information in the chat box. So next I'll move on to Diane William. Good morning.
Good morning. My name is Diana Willman. I work with the Gaston County Public Health, and I'm the Latinx, Latino, Hispanic Unido outreach. Thank you.
Thank you for joining us this morning. So next I have Dulce Arroya. Good morning, Dulce.
Hi, everyone. Good morning. Happy 2023. My name is Dulce Arroyo. I'm with North Carolina's Farm Worker Health Program through the Office of Rural Health with the HHS as well. And my coverage is statewide. So anything related to farm worker health, feel free to reach out. And I went ahead and put my information in the chat. Thank you.
Thank you, Dulce. Next, I have Edith Martinez. Good morning, Edith. We'll move on to Emily from Catawba. Good morning, Emily.
Good morning, I'm Emily Killian. I do community outreach for Catawba County Public Health.
Thank you for joining us this morning. Next, I have Ed, and I apologize if I misspell this or mispronounce this, Miss Ridrick. It's mute.
Sí, buenos días a todos. Voy a hacer mi introducción en inglés y en español. Mi nombre es Eniris Riddick Delgado y yo represento a la Z. Smith Reynolds Foundation. Gracias por estar, estoy muy agradecida de estar en este espacio con todos ustedes. My name is Eniris Riddick Delgado. I am a program officer with the Z. Smith Reynolds Foundation, and I'm really grateful to be sharing this space with all of you. And we cover all North Carolina. Nosotros cubrimos a todo Carolina del Norte. Muchas gracias.
Thank you for joining us this morning. So next I have, good morning, Janie.
Good morning, buenos días a todos. My name is Jenny Trejo and I work for East Coast Migrant Head Start Project. I'm the Family Community Partnership Specialist for Region 1. We cover the east part of North Carolina with 8 centers and 2 centers in Virginia.
Thank you for joining us this morning. Next, I have Jordan Han.
Good morning, everyone. Jordan Hanna. I am with North Carolina Department of Administration. I work on the policy team, but the main focus of my responsibilities is working with the DOA boards and commissions, and then also acting as a resource for other boards and commissions as well.
Thank you for joining us this morning. Next, I have Kathleen Liang, and I apologize again.
Oh, no problem. You do well. Good morning, everybody. Kathleen Liang from North Carolina A&T State University. I am the director with the Center for Environmental Farming Systems here at A&T. I have quite a few updates to share with everybody later. Nice to see everybody here.
Thank you for joining us this morning. Next, I have Kendra Guzman.
Good morning, everyone. I'm Kendra Guzman with Agape Health Services. I am chronic disease self-management program assistant, and we cover 5 counties. So we cover Beaufort, Martin, Washington, Hyde, and Terrell.
Thank you for joining us this morning. So next I have Linda May.
Hola, I'm Linda May at East Carolina University with the Mamás Activas program. And we service basically anybody who accesses or uses Bident. And we work with women during pregnancy and afterwards, so pregnant women and postpartum and babies as well.
Thank you for joining us this morning. Next, I have Luz Sanabria Reyes. Good morning.
Good morning, everyone. Luz Sanabria Reyes with the Governor's Commission on Volunteerism and Community Service, also known as Volunteer MC, and I am their Disaster Services Manager.
Thank you for joining us this morning. Next, I have Melissa Reese.
Good morning. I'm Melissa Reese, Community Relations Specialist with East Point.
Thank you for joining us this morning. Next, I have Mireya Alvarado, and I apologize.
Good morning. My name is Mireya Alvarado. I'm the Hispanic Outreach Coordinator at Alma Hopeline. Hopeline is a nonprofit organization that provides free and confidential services to survivors, victims and survivors of domestic violence, sexual assault, and we serve the 6 counties, which are Camden, Pasquotank, Perquimans County, Currituck, Chowan, and Gates County. Thank you for having me.
Thank you for joining us this morning. So next I have Paulina Kay.
Hi, everyone. I'm Paulina Catang. I'm the Outreach Coordinator for Raleigh Immigration Law Firm. We cover everyone from North Carolina and South Carolina, and even other people from around the United States. And we basically help all undocumented Latinos get their work permits or their license and everything they need to live like every other US citizen. We help all the Latino community with their their immigration issues.
Awesome. Thank you for joining us this morning. Next, I'm going to go to Philip Triplett. Good morning, Phil.
Good morning. Good to see everybody virtually. I'm Phil Triplett. I'm with North Carolina Emergency Management, the Office of Partnership Engagement, and I am the State Voluntary Agency Liaison, and glad to be here and ready to help out.
Thank you for joining us this morning, Phil. Next, I have Saritha Currents. Good morning, Saritha.
Good morning, everyone. I'm Saritha Currents, and I'm with Trillium Health Resources, and I'm head of Regional Behavioral Health, Disaster and Community Crisis.
Thank you for joining us this morning. Next, I have Stacy Howard.
Good morning. I'm Stacy Harward, and I work with the Division of, the Department of Health and Human Service, the Division of Mental Health, IDD, and Substance Use Services with the Community Engagement and Empowerment Team. I cover the west side of North Carolina and work with the LME MCOs, work with grassroots programs that are trying to get started. Thank you for having me.
No, thank you for joining us this morning. So next I have
Jorge? It's me?
Yes, Jorge, we would, but you can go ahead. Now's a good time.
Okay, thank you. Thank you. I'm Jorge Buzo from Community Affairs and News Coordinator in Univision, North Carolina, in Univision 40. And we're working in both areas, in news, as reporting, creating special reports and coordinating the newscast and the production and our community affairs show, weekly show, Contigo en la Comunidad. And while searching stories, searching, create links with the community organizations and while working for create content for our on-air spaces. So, well, I am available. Thank you.
Thank you, Jorge. So next I'll go to Stacy Taylor. Good morning, Stacy.
Good morning. This is Stacy Taylor, Director of Community Health at Henderson County's Health Department.
Thank you for joining us this morning. Next, I have Susie. Good morning, Susie.
Good morning, Marlena. Good morning, everyone. I'm Susie Cacciaturian. I use she, her, hers pronouns. I work at the North Carolina Budget and Tax Center, and we're a statewide organization, so we cover all 100 counties. And if you're not familiar with us, we are a policy, research, and advocacy organization focusing on primarily on economic justice and related issues. And I'm a senior policy analyst, and my email I put in the chat earlier. Thanks.
Thank you for joining us this morning, Susie. Next, I have Tammy Shadding.
Good morning. I'm Tammy Shadding. I work with East Coast Migrant Head Start Project. We serve the children of migrant and seasonal farm workers in campuses throughout Eastern North Carolina in about 14 different counties. We have a campus out in Boonville, in Yadkin County, and we serve children also on the Eastern Shore of Virginia in 2 counties out there.
Thank you for joining us this morning. So next I have Tawanda Sanders. We can move on to Yasmin Rico. Good morning, Yasmin.
Hi, good morning, everyone. Jasmine Garcia Rico with the North Carolina Department of Health and Human Services, part of the Health Equity Team. Thank you.
Thank you, Yasmin. Next, we have Yoshi. Good morning, Yoshi.
Buenos dias, everyone. It is such a pleasure to be here with all of you. I'm with You Can Vote, and I work in Pitt County, but we have people throughout the state. What we do is we focus on voter education, registration, and empowerment. And one of our areas of emphasis is outreach to underrepresented groups and to empower the Latino population in particular, because we know how important that is. I lastly wanted to say that I'm just so impressed with the people who are in this partnership and the breadth of the work that you do. Thank you so much.
Thank you, Yoshi. So next I have Ms. Walkiria Sessions.
Muy buenos días. My name is Walkiria Sessions, and I'm from Green County Healthcare, and we serve the regions 7 and 8. Thank you.
Thank you for joining us this morning. Ms. Wachter is put her information. She is a Mary Health Veritas Region 6 community educator. And then I do see a new person, Christopher Woods. Good morning, Christopher.
Good morning. How are you?
Good. I hope you're doing well.
Doing great.
So we're doing updates. So if you could say your name, agency, and any region you're covering.
My name is Chris Woods. I'm a community educator with the Mary Health Veritas. I cover 27 counties. It's too much to name. Any updates? We're gearing up for our different initiatives that we're planning across our region. We are currently working on our Rebat Backpack, where we network with different organizations and provide school supplies, because we do understand that, you know, the children need some more school supplies to carry them out throughout the year to finish out their school year. So we're working on that for the month of January. And of course, the month of February, we're centered around Infant Mortality Month. And we are working on developing a baby shower throughout the counties in which we're serving. We currently working with different organizations in the community. And so I've got a lot of things that we are currently working on for 2023 to address social determinants of health.
Thank you, Mr. Woods. And then lastly, I see Dr. Silvernail. Good morning, Dr. Silvernail. So we're doing introductions right now. If your name, agency, and the region you cover.
Hey, good morning, John Silvernail. I'm the Pitt County Public Health Director, and I cover Pitt County, but we also supervise a number of regional programs on behalf of North Carolina Department of Health and Human Services.
Thank you, Dr. Silvernail. And then lastly, real quickly, I want to do introductions for our team in case there's anything so that they have their contact information and you know who they are for this upcoming year. So I would like to start off with Elizabeth. Good morning, Elizabeth.
Good morning, everyone. My name is Elizabeth Kramer. I'm the Director of Operations at Amexcon. I will put my email and information in the inbox. I also lead the NC Latino Research Network.
Thank you, Elizabeth. Next, I'll go to Abel. Good morning, Abel. Estamos haciendo introducciones para que los que están en esta junta saben si los pueden contactar para cualquier cosa.
Muy buenos días, soy Abel Argollo Ramírez, coordinador binacional de la Asociación de Mexicanos de Carolina del Norte. Mucho gusto.
Gracias, Abel. Next, I have Bianca Perez.
Hi, good morning, everyone. My name is Bianca Perez. I'm the Director of Community and Cultural Affairs with Amexcon. It's a pleasure to see you guys.
Thank you, Bianca. Next, I have George Hendricks.
Good morning. This is George Hendricks. I'm the Director of Development with Amexcon. I'll put my email in the chat. It's great to be here with everybody this morning.
Thank you, George. Next, I have Jennifer Rodriguez Alvarez.
Hi, good morning, everyone. My name is Jennifer Rodriguez Alvarez. I'm the Director of Internship of Volunteers with Amexcon.
Thank you, Jennifer. Next, I have Juan Servin.
Good morning, everybody. My name is Juan Pablo Servin. I am the Director of Outreach Community. Nice to meet you.
Thank you, Juan. Next, I have Natalia Figueroa Bernal.
Hello, good morning. My name is Natalia. I'm one of the health program directors for Amexcon. I lead the NC Latino Health Alliance, and I hope everyone has a nice rest of your day today.
Thank you, Natalia. And then lastly, I have Nina Capasso.
Good morning. My name is Nina Capasso. I'm the Economic Development and Community Partnership Coordinator with Amexcon, and I lead the NC Latino Small Business Network.
Thank you, Nina. And then I'll do my introduction again in case for those that joined later. So my name is Marlene Castillo. I am the Community Development Director. Also host the NC Community Task Force that used to be known as the NC Latino COVID-19 Task Force. But with that, I'll move on to the next thing that we have on the agenda, which is the framework. So as we mentioned, it's just rewriting the language, the mission and the goals. So the purpose of this one is to be the voices of the community and advocate across different sectors in North Carolina. So it being advocacy, education, health, leadership. We want to be able to do that with this new framework and with you guys that have joined the meeting today. So the goals are 3: to be an interdisciplinary task force focused on Latino and marginalized issues, to intensively collaborate with community partners, community members, and federal and state representatives to educate the communities on resources and any up-to-date news, and lastly, to engage in our role as leaders and have consistency in our work. So it's really just rewriting the language of this, but nothing major. So next we have updates. So I am going to stop sharing and do updates at this moment. So if there's any health department that would like to provide an update, now would be the time. And I know there's a couple of you guys, I don't know if there's anything that you guys are working on for the new year that you'd like to share with us. If there's no health departments that have any updates, I can move on to any of our disaster groups that might have any updates.
Lynette, you say disaster groups?
Yes, ma'am.
Okay, hi. Good morning. Yes, I just wanted to announce Volunteer NC have started a series for 2023 year. It's a disaster series, and we are calling it Learning Together. The first presentation will be this month on the 20th at 1 p.m. I can add the registration link to the chat, but it will cover information about disaster case management, which is a critical program that is implemented after a disaster occurs. If we have a federal declaration, FEMA and the state activates that disaster, and what that provides is support on the ground from case managers. And so the presentation will cover information about how that program is implemented. And for the first time, the state will be covering information about how can organizations become a vendor and the process that the state has established. So again, I will be posting the link in the chat. And if anybody has any questions, I will also post my email information.
Thank you, Luz. Are there any other disaster related? If not, we can move on to DHHS. So Yasmin, good morning.
Hi, good morning. I do not have a lot of updates, but wanted to share a couple things. We are looking for a state opioid coordinator, and I'm gonna put the link on the chat for this job opening in case that anyone is interested, and if you can also share it with your network. I can share the larger email with more information with Marlene so she can share it on the newsletter, and I will also be including it in the upcoming noticias. And a couple other things, we're still promoting vaccines. We have a lot of information that will continue to go out to promote vaccines, especially around, I mean, everybody, but a couple groups are children, 6 months and older can get a bivalent vaccine. And we also are promoting this vaccine for the older population. We are continuing to see that we still need a large part of our population that needs to be vaccinated with the updated vaccine. I know that, people are tired and that people are still a little confused about where they are in the process. So encouraging them to visit vacunate.nc.gov or myspot.nc.gov, and I can put the links on the chat as well. We probably won't be sending a noticias this week. There's not a lot of updates to be shared. So if you're interested in receiving this newsletter, I will also put the link on the chat, and we'll probably be sending one next week. Thank you.
Thank you, Yasmin. So next I'll go over to our farm workers agencies that have any updates.
Well, during this month, we have very little, I'm sorry, can you hear me?
Yes, we can.
During this month, we are going to concentrate on to welcome really the farm workers that they are coming probably next month. They are going to start coming next month. We want to let you know that we are going to continue with the vaccination of everyone of the farm workers, their families, and anybody actually that they want to acquire their vaccination. So we are welcome anybody to come to our clinics and in Snow Hill, Greenville, and Palmico to be vaccinated. And we just trying to get ready for them. Thank you.
Thank you, Ms. Sessions. Is there anybody else? If not, we can move on to any health agencies that would like to provide any updates.
Hello.
Good morning, Max.
Hi, good morning. WellCare as always, part of changes in Medicaid, would like to let everybody knows that we're here. We would like to participate in any events that you have during the next few months. You know that there are many changes in Medicare are coming April 1st, and we would like to begin informing the community about all those changes. We also would like to begin having more baby showers. That as part of Medicaid, we should be doing baby showers every other month. So if you know about any agency promoting cares for pregnant women, we would like to, to encourage any agency to do baby showers with us. And as I say, we are planning to go to all our 26 counties discussing changes in Medicaid. And please, if you want us to be part of any event, please let us know.
Max. Is there any other health agency that would like to provide an update? If not, we can move on to education agencies that would like to provide an update. And Miss Kathleen, I think this would be a good spot to provide your updates.
Thank you so much. Again, I'm the director with the Center for Environmental Farming Systems. We cover the whole North Carolina and the Southeast region. Most of our work relates to food system, from production to supply chain to consumer health and waste management. We have a few updates. There's a new event coming up February 2nd. We will talk about food for medicine. And I'm going to put that information in chat box for you with a contact information for people to register. I'm glad that Max mentioned a lot of revisions or new information is coming out for Medicare and other healthcare perspective. This year, we want to focus on helping people to understand the food for medicine concept. So a lot of events are in the planning process. If you're interested in joining these events, just send me an email. My email is also in the chat box. So we can put you on the mailing list of these discussions. We invited the healthcare providers, Blue Cross Blue Shield, Medicare, Medicaid program leaders, and the other healthcare organizations to talk about how we can actually make a difference for minority population and underserved communities to access better, healthier food, but also to take care of the chronic illness to reduce the burden for these families. The second thing is we have a brand new HBCU Agribusiness Innovation Center that's established at AMT. This is a national center. If any of you works with agricultural related production, market, financial perspectives, please reach out to me. Again, we have service in mind to provide help to everybody. All of our programs and services relate to Spanish. We have different languages actually to share the information and the training perspective. I will also put the programs that's already translated into Spanish in the chat box for everybody to access. The third thing is we have the new NRCS, Natural Resource Conservation Service program in place to bring in more farmers, especially socially disadvantaged farmers, including women, immigrants, and other producers who are interested in doing conservation practices. So that's in place. And finally, we have a very exciting field day on July 12th and July 13th. We're in the planning phase. If any of you would like to come and present your program information, this is a great time to reach out. So we will put you on the agenda. Thank you very much.
Thank you, Ms. Kathleen. So is there any other education agency or group that would like to provide any updates? Hi, Tammy.
Hey, yeah, so I wanted to mention that, well, anyone who is aware of East Coast Migrant Head Start Project, you might be still thinking that all of our campuses close in the fall, usually around November, but We have received funding to, this is our second year to keep our Faison campus open year round. So they're open 12 months out of the year now. And that was to meet the need of a lot of the seasonal farm worker families that we have in the area. So if you know families who might need educational services, ages 6 weeks through 6 years up to compulsory school age, please send them that way. The Faison campus serves Duplin, Wayne, and Sampson counties. So just wanted to put that out there and let everyone know we do have a year-round campus now.
Awesome. Thank you for sharing that.
Thanks.
Do you have any flyers or any like little short paragraphs that you'd like for us to include in our newsletters as well? We'll be happy to share that.
Great. We will get that to you. Thank you so much.
Thank you. So any other education groups or agencies that would like to provide an update?
Yes, me, if you don't mind. Gracias. As I mentioned, I just recently joined the Division of Child and Family Wellbeing, and we have specific topics to talk. Of course, coordinating with other agencies. There is a big, huge updates with Medicaid, and basically my role is to train families related to the services for those families in need for any child or youth with disabilities. We have a line that can help with resources. We have a program that can help with the auditive process if your child has any disability. And as well as the agencies are mentioned, if you guys have any in-person event or any virtual event that I can join to talk to the services that we are offering, will be great to be there. As I've been involved with a couple of you in the past, I believe I have the challenge to know more of your agency. And somebody was mentioned, like, if there any possibility for having a mailing list to all the people who is here, and as well to try to see if there is I don't know if it worked like that, there is going to be an email where a general email when we can share information, I mean, every single week or something related to our agencies. Thank you very much. And you already have my information in the chat. Gracias a todos.
Thank you, Francisco. So yes, I was going to mention it later, but I can go ahead and mention it. So since we are transitioning from the COVID-19 task force, we are going to be having a new email, which will be the NC Community Task Force email. And so I will be creating a new MailChimp for that one. But I wanted to let you guys know I've been using the task force one, and I apologize for the background noise. He's running wild right now. But we're going to be creating a new MailChimp where we'll be sharing the information. So if you guys have anything that you'd like to share, that new email will be the one to send the information to, so that we can add it to our newsletter. And then from there, we'll also be sharing it with our big newsletter that Mexican sends out to all our community partners, so everyone gets this information. And so I'll be sharing that in the email. It's another thing I would like to mention, we are going to be switching to once a month meetings. So instead of every Monday, it will be once a month. It'll be the second Monday of each month. It'll be at 11 a.m. So I feel like that time worked for everyone. I did also want to mention that we will be doing, I will be sending a calendar invite, but it won't have the link, just because we're going to be doing, for each month, it'll have a different link, because we were having issues with the links, that some agencies weren't able to join the call because of that. So each meeting, each month will have a different link, but we'll be sure to share that with you. But the calendar invite should pop up on your calendar if you save it, whichever method you like. I know it has Yahoo, Google, and the Apple one. So that'll be an option for you guys as well. But that is our goal with this one. So if you guys are on this call right now, please enter your information in the chat box so that we can enter this to the new MailChimp. It just requires your name, agency, and email. It's optional if you want to add your phone number to where your office is. But yes, if you could please add that in the chat box so we can add you all, because we do plan to be launching that this upcoming month. So next,
Marlene. I'm sorry, I just wanted to ask a question. The neighborhood services is going to go out to the parking lots to serve the large community. But we wanted to take the home COVID test to every single one in the community. And right now we are very limited. I just don't know if somebody can let me know who is giving a large amount of COVID-19 tests so we can take it to the community at large. I don't know if somebody can provide me with that information.
Yeah, so this is the perfect spot. I know a couple people, maybe Yasmin or who else was on this call that might be able to have that information. So I'll let you go first before I can find.
Yeah, I can look into this if I can have your contact information, if you can put it on the chat and I can do a follow-up.
I think it was also Dr. Silver now, if he's still on the call. I know there's going to be a pilot going to be launching also about sharing these COVID test kits. I'm not sure if he's still on the call though.
That's true.
Is this the contact info, Mireya Alvarado?
Walkiria Sessions.
Oh.
I'm going to write it down.
Okay, if you can put it on the chat, that would be great.
Sorry, Dr. Silver. Now, are you guys going to be having COVID test kits?
Yes.
We are involved in a project with Duke in Test to Treat, which involves delivering test kits. I don't know if Abigail's on the call. She's really taken the lead on that. They're not going to be distributed to the community at large. They're going to be distributed through partners, and I believe she enlisted a Mexican as one of the partners. We don't have them just to give out at the health department anymore. The state did have a portal where folks could order, groups could order those. I'm not sure if that portal is still alive or not. It's still operational at this time.
Dr. Silver now. So we'll be in contact with Sessions to see how we can get those to you.
Okay, thank you so much. I truly appreciate it.
Thank you. So back to updates. The last last group I have is advocacy agencies or groups. If you guys have any updates you'd like to provide. If not, lastly is the Mexican updates. So I will pass it over to Elizabeth. I don't think, okay, so for this week, for January, we have our task force meeting today. We will not be having another meeting until next month. I'm trying to see the calendar. Yep, there's nothing going on this week for a Mexican. So we'll be sharing anything that does come up in the next couple of weeks. But I did want to go back to the questions that I had. So for this upcoming year, and you guys can enter this in the chat box as well, what speakers would you like to see? So it could be like from federal level, state, nonprofit, you know, anything that you guys are looking to see this upcoming month. Please enter that in the chat box so we can get more content to have for next month and the upcoming months as well. So I'll just give you guys a little bit of time to enter anything that you'd like to, any agency or organization you like to have on these calls.
Hello, this is Yoshi. I'm wondering if there is a possibility to reach out to someone at the NC legislature. If there's a committee, both a House and Senate committee that focuses on Hispanic Latinx issues, you know, a way we could find out what the legislature is doing in terms of promoting bills and getting those to the floor that would benefit the community.
Well, thank you, Ms. Yoshi. We can definitely look and see what we can do. We can't make promises, but we can definitely look into that.
Marlene, can I comment on that? I think we have Hannah from the Office of Administration. She's still here?
Yes, I am.
Yeah, Hannah would be the great resource for that. Maybe Hannah, if you can help us out and
Yeah.
and get somebody from your area or from somebody other branch can talk about policies and advocacy around what's going on in the General Assembly.
Of course, yeah, I will reach out to our team and I'll get in contact with you all, see what we can get set up.
Okay, thank you, Hannah.
You guys are welcome to enter. If not, just email us. So I'm going to go to the next question. Would you guys be interested in collaborating for an in-person event for our communities? Not anytime soon, but we have a whole year, so we can definitely plan to have something together. So you can just put yes, no, thumbs up, thumbs down. I just want to see like what this year I want to plan some, different things than what we had last year. Of just meetings. I do want to have more actions and involvement in the community. So please let us know. I'm getting lots of yeses, so we will start planning and seeing how we can make this happen. And then Yasmin.
Yeah. Hi, I wanted to follow up and ask if the Latino agenda has been sent to departments and agencies, or like any update on where that is.
So I will let George or Juvencio answer that one.
Thank you for the question, Jasmine. No, this is coming up. This is in the next couple of weeks, we're going to be working on that. And I think Marlene is going to bring up something that's going to happen in February. There's going to be kind of the formal official presentation of the Latino agenda. And for the different branch of governments or agencies, we're going to send it out in the next couple of weeks. And I will give you an update on that too.
Thank you, because I was thinking, sorry.
Yeah,
Sorry,
and also Hannah from the Department of Administration, which also we've had a conversation with the secretary on that.
Because I think it would be helpful if we have presentations that, I'm sorry, I'm going back to the previous question, Marlene, because I was thinking if we can sort of spend about the same time per se on each sort of bucket, and maybe dedicate, like go deeper into those sort of areas and recommendations through presentations, if we can learn like what are some of those best practices or some sort of way to go deeper into each conversation throughout the year, just to kind of make sure that we have dedicated time and we're not in a meeting touching so many different areas that it's hard to dive deeper, if that makes sense.
So I think one of the things that would be great, thank you, Jasmine, for that, to bring it up. I think it would be great, Marlene, for the members of this community task force to bring up the presentation of the Latino agenda. So can everybody see it, what is on the Latino agenda? And based on what Jasmine is recommending, let's just move forward for some of the specific areas, because on the Latino agenda covers education, health, policy, public safety, and economic development. So if we can get George, if we can get you to come back next month and present it to the members of the task force to kind of outline what things that we can do and work together.
Yes, definitely. So the next slide actually is on our NC Latino agenda, Striving Towards Health Equity Conference. So it'll be on February 24th. This is an in-person event. It's going to be from 9 a.m. to 4 p.m. It's going to be at the Embassy Suites in Raleigh. I will be sharing this also with you guys via email. So you can sign up. Space is limited, but we are open to everyone to come and, you know, collaborate. So a little bit about this. It's designed to bring together a diverse group of people who are working to advance health equity for Latinos in North Carolina with the goal of educating, advocating, and empowering the community to take charge of their health and work with the systems and state to close health disparities. So this is a project that we were working on. We're going to have a couple of guest speakers and panelists. So we hope you guys are able to join us. It'll be a great space. Lunch will be provided as well as some snacks. So because it is a day-long event, but we really hope that you guys will be able to join us. And I know George is on the call as well as Natalia. I'm not sure if I missed anything that you guys would like to add.
Well, I think you've covered everything, Marlene. Thank you so much. And I'm really excited for this summit. It's mostly just going to be focused on health and, you know, adding on to the already existing Latino agenda that we created with you all in October. So I'm really excited and I hope that you guys can attend. As Marlene said, space is limited, so definitely register ASAP.
And we will be having a cutoff date for RSVPing just because we do have to have the amount of people for the lunch so that we can let them know how many people are coming. But we'll be sharing that in our email as well. But that's all I have. Juvencio, is there anything else that you'd like to add?
No, I want to say thank you, Marlene, and I want to say thank you to other members of the task force. I know we do have some new faces here. One thing that back onto a directory of all the agencies, all the members of the task force, as Marlene said, we do have a newsletter that goes out, and the newsletter it is part of your work, guys. So anything that is happening within the framework that you're working on, or anything that you want to do to outreach and engage, send us information to us, and we can put it on a newsletter that goes out, so we can let the people know what's going on in your different agencies. The second thing that I would say, also the benefits for this task force, you know, always reach out to us for anything that you need from your agency, or you want to make connections with other members of the task force. You know, we want to be very intentional in terms of how we build outreach and engagement, but also a long-term relations with some of the great agencies. As Marlene said earlier, you know, this is a very interdisciplinary group. You know, we cover from health, education, advocacy, policies, and others. And we want you to help us to help this framework the same way that we did with the Latino COVID task force. I think the Latino COVID task force really was a great, effective, and I think this is going to be even greater because it's a multidisciplinary approach and bringing different voices, different lens to addressing social issues in North Carolina. So we're looking forward working with you guys, and don't hesitate to reach out to the members of the staff here in Amezcan, anything that we can do for you. The last thing that I would just say is, you know, speakers for some of these spaces. You know, last year, you know, we used to meet every week, but now we're gonna go on a calendar that once a month. So if you have any good speaker that you want us to bring to you guys, let us know. It can be around health, it can be around education, it can be around policy, or any other thing. Also, one thing that I think we're missing here, culture. I think we need to add culture within this framework, because a lot of agencies that we had interact in the last 3 years, they always love to participate in a lot of multicultural events where we can engage with the community. So with that, I say thank you and have a wonderful week, beginning of the year, and we look forward to see you next month. I think our next 2 meetings, or next meeting will be February 13th, and then Marlene, you can cover that.
So the next meetings we have coming up on January 30th at 11 a.m. Will be our NC Latino Health Alliance, hosted by Natalia Figueroa. And then in February on the 13th at 11 a.m. we'll have our next NC Community Task Force meeting. In this meeting, we'll have George present the Latino agenda to you all guys, because that next week actually will be the week that we have our conference. So we hope that you guys can join us. Be sure to I will share everything on the COVID-19 task force of the new NC Community Task Force. So if you guys have anything, still continue to send it to the task force, the COVID-19 task force. And yeah, next month we'll have everything situated for this new community task force email and MailChimp. So thank you guys, and I hope you guys have a great week.
Thank you.